Well, good morning. How are you all doing? Okay. I love your name. Bernita? Is that how you say it? Yeah, that's beautiful. All right, I'm going to practice very hard to stay in front of this camera. But if I start veering, I want somebody out there go to stay over here, stay over here. All right, we are here to talk about a very, very interesting and exciting subject, Medicare. How exciting is it? Yay! Okay. It's that exciting. So I am Carolynn Washington. I am the Education and Outreach Coordinator. I am also the volunteer coordinator for our organization. Is anybody familiar with HICAP? Okay. Oh, okay. All right. Well, one person, nobody else. We counsel right here in this facility, but we'll get to that. So our organization is designed to assist you with navigating this sometimes complex Medicare system. So today, we're going to spend some time together. How much time do you have? Okay, we'll be here till 8 o'clock tonight. All right, so we have about an hour and a half, and if I understand, if you've got to go, I've given you a lot of information to take with you, but we are going to kind of crack the code on Medicare today. Are you ready? Yes. It's a lot, and so if you are going to take notes, fantastic, but if not, and you signed up for this class and you have an email, these lovely folks here at ACC can get you this entire presentation. It's 93 slides, so it is a lot, but it will help you dig into understanding Medicare. Is it this very easy thing to understand? No. Okay, so before we get started, so I make sure we got a nice group, but I need to know kind of what are you really here for? And I will kind of put it in the back here and make sure that I get after it or make an effort to get after it in this very detailed explanation of Medicare. So give me an idea and you got to be quick with it. Yes?
Do we have the right plan?
Do we have the right plan? Okay, that's a good question. Get all the information that you can. All right, issues, things that you came here to kind of get unpacked with Medicare. Don't be shy. Let me know. Dental insurance. Okay, is dental insurance available? How do you get it? All right. I had a hand back here.
Yeah, my wife's a member of the she's a retired federal employee, and she has Medicare and the federal employee health benefits plan.
Right.
And I'm also on Medicare, and I just need to know if we have too much health care.
Right, so how to coordinate. All right, because that's very important. Coordination can even complicate it more. Yeah.
Do you work with a lot of people who are on CalPERS?
Absolutely. I've been to 2 CalPERS events this year, and I got a funny story about the last CalPERS visit. So yes, I'm familiar with CalPERS. What else you got? All right, that's it. Everybody else can go, and these people. All right, so that gives me an idea. Let me see right off the bat, how much do you know about Medicare? Tell me about the parts of Medicare, because I have a great 2024 calendar for you that has all of the important Medicare dates for you to kind of keep abreast of things. Anybody want it? Yes. Okay, you got to win it. So tell me what you know about Medicare. Yes?
If you don't do the right thing at the right time, you can be charged for pretty much forever after that. The penalties of not signing up in time or for the right things.
You know what? I'm going to say yes to that, and there's some no to that. I'm going to say yes, but then there's some no's. There's some no's to that, but she's definitely right. These penalties are out there, and you have to sign up on time when you should. You have to know. Tell me more about what you already know about Medicare. Yes?
Parts A and B.
Okay.
Parts D.
Okay.
Drugs.
Okay. What's A cover?
One of them covers the hospital and the other one covers the doctors.
Anybody know what A covers? Hospitalization. What does B cover? Does A cover more than hospital? Okay, all right, we got some ground to cover there. All right, what else do you know about Medicare? That'll get you started, yes.
If you sign up for Medicare Advantage and you try to go back to Medicare, that the gap insurance doesn't have to accept you.
So no, but I like that you brought that up. I like that you brought that up.
Well, if you
So,
have existing conditions, I think they have to accept you.
okay, we're going to talk about that. I'm so glad you brought that up. And because you did, I am going to give you a calendar also. Go ahead, can you pass that to her? Yes.
Is she talking about the Medicare plan?
She is talking to, are you trying to get a calendar? Okay. She is talking about the Medigaps, and she mentioned Medicare and Medicare Advantage. What's the big difference, and are they both still Medicare? Anybody know?
No.
I don't think so.
Lots of different answers here. Okay, all right. So you have one more?
No, I was just gonna say the Medicare Advantage includes, some of the Medicare Advantages include dental, vision, as opposed to just Medicare A and B, from what I understand.
From what you understand, it can, but it does not always. So, all right.
Can I get a calendar?
Oh, so sweet. Oh, so sweet. Oh, so sweet. All right. Okay. What about this thing? What about this thing right here? You know anything about this?
Oh, yeah, that's at home.
Yeah, it's at home. We're going to talk about this book and how it can actually be of benefit to you. Let's kind of go over the things that I want you to have in your hand because I'm going to make reference to them. First is our brochure, the blue one. Then I've given you also one on Medicare fraud, which is very important. I have also given you this bulletin. I really want you to make sure you have that because we're going to talk about that. And then there's this great thing that's happening with Medicare. Anybody know about the Medicare savings plans? These are ways that people can save tons of money on their Medicare if they sign up for these. And then also, this is the great one that I've copied today for you. This is all of the things that you need to know before you sign up for a plan and some questions that you may have for your health care before you sign up for a plan also. All right, making sure you have those, so let's go ahead and get going. All right, so the monitors, if you can see them, that's fantastic. But again, if not, you can have a copy of this presentation. So if you're a note taker, fantastic. If not, it's good if you hear this. And if you have a partner here with you, you all can talk about it later because it's dense information, right? So these are the things we're going to cover. Medicare, all the parts of Medicare, the preventive services, which Medicare has put out another booklet on the preventive services, and of course, healthcare plans in the area. Anybody live outside of the area? Yes, okay. And maybe have relatives or whatever that are outside of the area of Sacramento in other counties. We're going to talk a little bit about that. Okay. And I am so most folks, yes ma'am.
Is there an age limit to be on the Medicare?
Is there an age limit? 65? If you do not have a disability, if you have that condition, you can sign up whenever you have been by the state identified as a person with a disability or in renal stage, so there's some other conditions, but 65 is the benchmark. Yes?
You said in the area in Sacramento.
Correct.
Sacramento County. Well, what about the surrounding counties to Sacramento County? Does that, the immediate surrounding counties to Sacramento County, is that included?
Yes.
Excluded?
No, it is included. It is included. So all of the counties are different when it comes to plans, and we're going to talk about that because insurance companies, they provide insurance plans or health care plans to individuals based on what?
Where they're located?
Yes, but what is the locator?
Your zip code?
There we go, zip codes. I wish I had, do you have a Medicare in you book?
I don't have anything.
I don't have anything. Okay, you know what? I'm going to give you a book because I'm so glad you knew that. Most people have no idea.
Thanks.
You're welcome. The zip codes are the thing that drive where insurance companies are going to provide plans. So if you move to Davis, you'd have to acquire another health care plan because it's outside of this zip code. If you moved even as close as Woodland, where am I going? If you go Placer County, different plans also available to you. You move from the Bay Area, absolutely different plans. So I'm glad you mentioned that.
Be different plan.
Why?
Yeah.
Well, insurance companies, they survey communities, and based on the number of people in that community, based on their success that they've had with selling plans in that area. But one very important thing, it's based on resources. So like Brownsville, a small community going towards Yuba County, they may have only 3 doctors in the area and a small clinic. And so a Medicare Advantage plan isn't going to go there because they don't have enough resources to pull from to provide those citizens there.
How about Washington State, no county of Washington?
Again, it all depends on what services are available in that particular zip code. All right, so wait a minute. This is how a lot of folks feel when they come to getting ready to start Medicare. What's that feeling that you get when it's open enrollment or you're just starting? Anybody just starting Medicare? Okay, what's that feeling that you get?
Fear.
Yeah, that's the one. That's the one. That guy down there with the ABC and oh my God, that's, I want to say 100% of our calls. Nobody's calling us with, hey, everything's going great. They are really concerned about how to navigate this system. And so today I hope to reduce a little bit of that anxiety by addressing some of the basics of Medicare, but how you then can use information to kind of transition. That's all this is.
I've been wondering how come Medicare keeps adding.
Okay, I love that. Why? Why does Medicare, why is it so complicated? In this small room, we're representing a very teeny tiny slice of the people, even in Sacramento, that are on Medicare. I clearly talk to over 1,000 people a year about this thing, and every last one of you has a different life circumstance, your different work history. Everything about you is unique, and Medicare is constantly trying to adapt to the needs of the Medicare beneficiary. And so it becomes pretty complicated. I cannot go to Bernita or go to Grace and say, hey, you guys, you want the exact same plan? What would you say? No, absolutely not. And nobody wants a cookie cutter. They all want their thing that's just right for them. And that's why it becomes difficult. So this transition for some may be they're leaving a state job and going into Medicare. They may be at the federal level and going. They may have never had any income prior and moving into Medicare. All of these circumstances drive your possibilities, your eligibility of plans that are available. So, what is the difference between an insurance company and a health care plan? The difference. Insurance companies, those are the Aetnas, the AARP, Blue Shield, Blue Cross. And so if I asked you, sir, what's the health care plan that you have right now, if you don't mind saying?
A and B.
You have A and B, okay, all right. Ma'am, what about you?
Sutter.
Sutter, okay, and Kaiser. So I could go around the entire room, and each one of you, even with these 3, have not given me any idea of what their health care plan is. The plan.
For those people on Medicare, you would know, if they just say Medicare, you know what their plan is.
Nope, I do not.
Oh.
I do not. I do not. There's so much, because they could have a Medicare Advantage plan.
But if they just had a plain Medicare plan, you would know then what they have.
If they had a plain Medicare plan, they still haven't told me if they have original Medicare.
That's what I meant.
Okay. Or if they are combining their original Medicare with some other health care. So there's all this getting into the weeds of really knowing your plan will be on that little card that the insurance company has provided. How many plans can an insurance company have? They can have lots of them. And so that does absolutely complicate the situation. And how do you select the right plan that's for you? So here are some questions that automatically pop up for people when they are entering into this world of Medicare. How does Social Security and Medicare work together? What's their connection? Social Security and Medicare.
Well, I know that people pay your premium through your Social Security check if you're paying Social Security.
People pay a premium,
They can pay it through their Social Security check.
and that is almost most of the time. You are absolutely right. That premium for your Medicare is coming out of your Social Security. But what if you don't have Social Security?
Pay by check.
You can pay by check, right? So the connection with, again, the question, Social Security and Medicare, I love the start.
And they're also the ones that determine that, what's that thing, you have to pay more for your Medicare. You get that letter from Social Security in November.
Depending on your income?
Yeah.
Yes, they do determine that. So can you go to Social Security, the Office of Social Security, and get your Medicare questions answered?
No.
Why not? I mean, they are paying the premium. They are doing a lot of that.
They don't know.
Okay, Eric. So we counsel in a number of Social Security offices, and they try. I promise you, they try really hard to kind of understand, but it's out of their wheelhouse. Social Security in itself is this huge networking system. They are definitely connected to Medicare, but it's not where you can go for your answers. Is there a Medicare office that you can go to? Some brick and mortar building that you can go to? Who says yes?
I think so.
Who says no?
Not sure.
Not sure. There is no building. There is no building. Why? Why doesn't Medicare have this place? Well, the intention is all of the money that you have invested when you were working into Medicare, they want it to be for you. They would prefer not. And so everything is online, and then you are left with us only. Not brokers, not agents. There may be some fantastic agents out there, but is there a such thing as a Medicare, let's see, what do they call themselves? They're either an agent or a broker, and they will say that they are a specialist in Medicare. Is there a such thing? A insurance broker that has contacted you and said, hey, I'm a specialist in Medicare. I've been certified. That's the word that they will use. If anyone comes to you with that notion, there is no such thing. There is no such thing. They can be knowledgeable about Medicare, but HICAP is the only entity that is certified to do this kind of education around Medicare and to assist you with navigating. Yes?
I thought if a person had an insurance license,
Yeah.
they can actually help with Medicare.
They can help with Medicare. They are not certified by Medicare. I love that, because if you have an agent or a broker, who are they representing? Themselves and who else? The insurance companies. Are they representing you? No. Yes.
Who's certified?
Who? Well, that's a good question. It would be the insurance companies have certified them and not Medicare. Medicare does not certify insurance agents or brokers to be counselors or certified sellers of Medicare products, period.
When
So-
you buy Medicare A and B, but don't give you A, C, why?
So A and B are specific parts of Medicare. C is Medicare Advantage, so you don't need both. And I'll talk more about that. What about these things? Penalties, penalties, penalties. We mentioned a little bit about them before. Why? Why do they have these penalties? Is Medicare optional? Do you have to sign up for it or no? Who says you have to sign up? And who says it's optional? You don't. It is optional. It is absolutely optional. You do not have to take it. So let's say this entire room represents the 6 million people in our state that are on Medicare, and this side of the room opts out. Your premium over here for your Part B Medicare, what would happen to it? Because we're all not paying in, but Medicare said no. They said let's leave it, and anytime these folks decide to jump in, they're going to have to play catch up. I think they should have used catch up as the word. You know, penalty is so punitive. It makes it sound like you had to, right? But you don't. You just have to be willing to be subject to a penalty. Are all the penalties the same for A, B, and D? Are all the penalties the same?
I doubt it.
They are not. They are not. And we're going to talk more about that. All right. So we've talked about why it's so confusing. Yes, ma'am.
I was curious to know, why is it when you first sign up for Medicare, if your birthday is on the first of the month, you have to sign up before you reach 65?
Absolutely.
Why do you do that?
Your birthday month is the indicator to Medicare and to Social Security that you're ready and that you're eligible. They use your birthday month also for when you are.
I'm talking about if you're born on the first of the month, you have to have, like me, I'm born on October 1st, so I had to have registered by September 1st.
So Medicare gives you, and you don't have to, you
By the
still.
month of September, I had to.
Well, and I will tell you.
Well, I guess you get the 4-month window, but the 4-month window is around the month of September.
It's not a 4-month window.
Oh.
Nope.
Oh, 3 months.
It's a 3-month window before. It's your birthday month and 3 months after. So you have a large window, regardless to your birthday on the 1st or the 31st or whatever. Everybody has that window.
It gets shifted a month forward if your birthday's on the first of the month.
In terms of when you would start receiving your
No,
Medicare.
but when you have to apply, I think.
Nope. No, ma'am. No, ma'am. Everybody gets that 7-month window. 3 months before, your birthday month, 3 months after.
It's when you start receiving benefits.
That's exactly what I just said. So whenever you enroll is going to dictate when you start receiving. Our organization is designed to answer and break down all of these questions. We're unbiased. We don't work for any insurance company. We are your advocate. That is the key word that is important with our organization. Yes.
There's a lot of classes or seminars on Medicare. So this is really stupid to say,
No.
but are they all your company? I mean,
I love that. I love it.
stepping out into different.
Okay, so online there are tons of HICAPs throughout the entire country, and we all have brick and mortar buildings. These are contracts that have been given to us through the California Department of Aging that's representing Medicare only, and all over the country you can find an organization like this. We put stuff online, Medicare puts stuff online, Medi-Cal puts stuff online, so it's always about the source. Do insurance companies, if you Google Medicare presentations online, you may get an insurance company that pops up first. So it's always about who's doing the presenting, because a lot of the information is fantastic if it's basic, but then when you get into picking a plan, they're going to start narrowing it down to the plans that they represent. Yes, sir.
Well, you work for this ACO?
No, I do not.
All right. How do you get paid for your?
I love it. We are a nonprofit organization, and so the California Department of Aging, the Area 4 on Aging, Area 12, and Area 11 provide us income. Legal Services in Northern California is our, it's not moving. They are our parent organization, and so they kick in some dollars, and so we get funding from a number of grants that allow us to do this service for Medicare beneficiaries.
So this money comes from the California annual state
No.
budget?
No, no. The California Department of Aging receives money, and then that money gets distributed to all of the HICAPs in
How does
California
the California Department of Aging get its money?
through the Medicare budget, and also, what's bigger, all of the insurance companies that provide plans in the entire country have to pay a tax for providing those services, and Medicare gets that money to provide this service.
So it's federal money.
Well, no, because all insurance companies are not federal, they're private.
No, but he said, and.
And yes, we do get federal money, absolutely. Absolutely. So, Legal Services in Northern California is our parent organization. They do all of these things, housing, they do some insurance benefits. Anybody in here on Medicare and Medi-Cal at the same time? Okay. We also assist folks with that need, and also Legal Services does. All right, so let's get into Medicare. So, all of you in here, is there anybody who worked for the railroad? Anyone who was a former teacher worked for, okay, all right, got some teachers. So, railroad retirees, some teachers, some individuals did not pay into the system based on who they were working for. And as long as I've been doing this, I have found folks who made a choice to tell their employer, don't take Medicare or Social Security out. Well, it is a choice, and I had no idea. Your little check stub that you received, you earned a small bit of that money that you were earning went into your Social Security and went into Medicare, and then you then acquired this benefit, right? Social Security and also Medicare. Your employer paid a little bit into it, you paid a little bit into it, and now it has become this entitlement to you. Now, is it a freebie? Is the state giving us this thing, Medicare? And that's why this whole entitlement, let's get rid of the entitlement programs really gets me going, because this is money that we have all what?
Earned.
And paid into, absolutely. And so navigating that with all of these folks that are in California and throughout the rest of the country, narrowing down what it is that you should consider before you take this hard-earned money and get this thing that's so necessary, a healthcare plan. How do you figure it out? Because as I mentioned before, it is really individual. The thing that I run into most is someone comes in and they say, I want the same plan that my sister had. You know, I mean, she has a great plan. She lives in Nevada, and I want that. I had a lady tell me yesterday, you know, 3 years ago, I had a great health plan through my employer. I want that same thing. Okay. And now 3 years ago, and now her health is completely different. She's fallen. She had a hip replacement and a knee replacement. She has a specialist. Her needs are specific. And so, what though is the thing that you should, there's a lot of them, what are the things you should consider prior to cost when it comes to picking a plan?
Your health situation.
Your health situation. What else?
If your doctor.
That's the biggie. That's the biggie. I've given you that one printout, handout that's not a pamphlet. It talks about these 11 things that are so important. Why is it that this whole doctor situation, why is that important? Doctor offices, they are very similar to us. Healthcare providers are very similar to us. Insurance companies come to them and they say, hey, you know what? We have a great plan we want you to offer to your patients. And they may pick it up. It could be Blue Shield, it could be Aetna, it could be whatever. And your healthcare coverage has to match that. And so if you, let's say, have Sutter, right? If you have a Sutter plan, you're loving it, you like the doctors that are associated with it, and all of a sudden you come up with a condition that Sutter says, hey, yeah, no, we can't, we've tried, but we can't figure it out. and you have to leave that system, but you still want to keep a couple of the doctors that you have, that becomes a complicated situation because your physicians and your healthcare providers are the drivers of the care and plans that you need. Does that make sense? Your physician, your specialist, they only take a certain number of healthcare plans. And some do, which is fantastic, take original Medicare. So you have to walk in with a card that matches their plans that they will accept. Yes?
I know of a doctor that doesn't take Medicare.
And there are some. And there are some. And they may have taken them in the past. They may have decided not to. Some doctors decide that they don't want to take Medi-Cal. So prior to the pandemic, that number I had not, in the years I've been doing this, I had not ran into any doctors that did not. Since the pandemic, some are more leaning towards Medicare Advantage, but even that is changing, and we're going to talk about that. So knowing your physician, knowing your health care, knowing the prescriptions that you're on, we're going to talk about all of these things that are relative to you selecting a plan that's right for you. I mentioned this book. This thing, if you dig into it, I'm not talking about reading it front to back, because how often does it come out?
Once a year.
Once a year. And is the information all the same? No, you definitely, but you don't have to read it from front to back. It's very issue specific. So if you have it at home and it's propping up a table or something like that, dig it out and kind of go through it. Who has a book? Okay, what's on page 67? No, I'm joking. All right, so your book is very helpful. Every single year, Medicare changes. Every year. What about during the year? Does Medicare change during the year?
Sure.
Absolutely. It depends on circumstances. Big fire happens, they try to adapt and give Medicare beneficiaries some help out. Some health care situation that we had during the pandemic, Medicare jumped in there and made changes. And so keeping abreast of what these changes are every year, this book is going to help you with that. But then at the end of this presentation, I'm going to give you a couple of websites that help you as Medicare beneficiaries stay abreast, because I study this 6 days a week. I just can't help it. I'm a researcher. I love to kind of dig in there and figure things out. But what about you? You want to study this every single day? You got your life to live. But staying abreast of the savings plans, how much are the prescription drugs this year going to be? Do you know that you can get a prescription drug plan for 40 cents a month? I'm not advertising them. I just know that they are out there. So all of these updates are important, and every year, does the premium go up or down for Part B?
Nothing goes down.
Okay, last year, big dip down. This year went slightly back up. So it all depends. And some people, they pull out their Social Security check and they're like, oh my gosh, where'd all this money come from? You know, and then they go, oh my gosh, where'd all this money go, right? And so to know that the fluctuation of Part B and the premium that comes out for it does change, it's important for you to stay abreast of these things. What is the thing that impacts the premium for Part B to change?
Enrollment.
What?
Enrollment.
Nope.
How much they pay out.
Nope. We'll talk about it. All right. So here are the parts of Medicare: A, B, and D. And Part C, these are the parts of Medicare that are all involved in your Medicare Advantage plan. Grab your bulletin, open it up. In this diagram, it allows you to see how Medicare is provided to you by choice. Every individual has the opportunity to choose these either or pathway. One is a pathway of original Medicare, and one is the pathway of Medicare Advantage. They both provide you the opportunity to have the 3 parts of Medicare. The intention of these parts of Medicare is to provide an individual with all of their health care needs. So let's talk about them. What are your health care needs? Nothing. No health care needs at all. Come on. Hospitalization, doctor, and what else? We need more. We already said prescription. Got those 3. What else? Vision and dental. What else? Hearing. What else?
Thank you very much.
Mental health. We'll throw that in. I'll take it. Skilled nursing. What about that?
Long-term care.
Long-term care. What else? Durable medical equipment. All of these things are ideally to be met through your parts of Medicare. So let's talk about it.
Are you going to be talking about long-term care at all?
A little.
A little?
A little. Because long-term care.
Like me, as you can see, I'm in a wheelchair. I cannot walk very good. I have lots of needs,
Sure. Sure.
and as I understand it, I have them all. What are all the needs?
Oh, okay. You're saying you have all the needs?
Yeah.
Yes. Okay.
I don't know what they are. Would you please tell us what all the needs are?
The ones that we just covered, hospitalization, skilled nursing, all of those, or more?
More.
Okay, all right, a little bit, I'll talk about that. So, each individual has an opportunity to choose this pathway, and throughout the year, depending on your circumstance, you can jump in and out of these pathways. These pathways determine how you access your health care services, right? Original Medicare is one pathway, Medicare Advantage is another, all right? So if you are taking a look, Original Medicare has all of the parts A, B, and D, and then there's a supplement. Medicare Advantage has all of those parts and also can have Part D in it. Let's talk about Part A. Part A does not only cover hospitalization, but it does cover skilled nursing, home health care, and hospice care. Did you know that Part A took care of all of that? So if you have the red, white, and blue card, regardless if you have Medicare Advantage or Original Medicare, and you need hospitalization, some procedure done, you pull out that red, white, and blue card, and it's taken care of. Now, the premium for this particular part of Medicare, for most people, it is going to be premium free. There's no monthly premium for Part A. If you leave that hospital and have to go to skilled nursing and you stay there for a period of time and then have to go home and need home health care, and then if you take a dip, which would be so sad, and then needed to be prescribed into hospice care, all of that would be taken care of with that red, white, and blue card, Part A. So, there is a premium though for Part A for folks who did not pay in, and it is pretty steep, right? And Part A also has a deductible, so if you have that hospital stay, there is a deductible that you will pay, but everything else while you're in the hospital, prescription drugs, all of that is covered under your Part A. They are not going to dip into your Part B or D while you are having this hospital stay. One thing to know, if you have that hospital stay, Let's say you went in as an emergency. Oh my golly, something happens, I've fallen, you get in there, and they keep you in observation for 5 days. And you get out, what are you going to get?
Bill.
Why?
Because you didn't stay there for anything else.
No. Close. You have got to be admitted into the hospital for Medicare Part A to pay. You have to be admitted. Some hospitals are unfortunately taking advantage of this evaluation, and we've had a person be in the hospital for 11 days and they still said they were observing, in observation. And we were able to correct it and get them to not have to pay that absorbent fee, but it is very important that when you have a hospital stay, that you are admitted. Who in a hospital stay gets the best treatment? Who gets the best treatment?
Those who pay a lot.
Those who pay a lot? I know. That's the assumption, but that's not the truth. They've done
Ones that
so
have
many
the best
surveys.
program.
The ones who have the best program? Nope, absolutely not. Because when you go to the hospital, there aren't AARP beds or United Healthcare. When you get there, when they admit you, they aren't examining, okay, they have this kind of service, that's the service that they get. No, it's not. No, so many studies, they've tried to disprove this, but it's the person who has an advocate. It's the person that has an advocate. Someone, either you are your best advocate. Sometimes people call me when they're getting ready to go to the hospital. Hey, I got to take my daughter. Just kind of refresh me on what I need to remember.
Can I have your number?
Absolutely. Absolutely. It's on the back of that blue card. So absolutely, an advocate, you being the best advocate for yourself, but if you can drag somebody along with you, if you can have a list on your refrigerator of the people who need to be called, if you have it, I carry it in my wallet, call these people because they need to be there. If you are not feeling well and get to the hospital, a lot of times you're not remembering what to ask and what they're doing. I had a friend just recently had a horrible back surgery, neck surgery, and it was horrible. And thank God I was there because they tried to kick her out of the hospital when she was paralyzed on one side of her body. I said, no, she can't go home like this, And unfortunately, they can say in the night, we're going to discharge you in the morning. If you don't have somebody there, or at least yourself, with the ability to push back and say, no, I'm not ready, it's helpful. All right, so Part A, there is a penalty. Yes, sir.
So I have a question. When you talk about not being admitted to the hospital, you end up with this big bill. But if you have a Medigap insurance, I'm assuming that insurance would cover it?
Depending on the Medigap that you have, because all the Medigaps are different. And we'll talk about that.
Medicare?
I will absolutely talk about Medigaps. Yes.
You asked the question, who gets the better care? What about people that have the concierge?
You know what? And now you're talking about concierge. Now you're talking about service, right? Now you're talking about which concierge is better than the other, right?
But the idea behind the plan is, you don't have to wait for a doctor because the doctor's supposed to be available.
Now, so in terms of access, fine. Yes, concierge, that would be fantastic. But still, when the doctor comes to you, if you're not in your right mind, an advocate is going to be there to help even in that scenario.
What's concierge?
It's an insurance plan that you can purchase, and it has all of these bells and whistles where you get to, it's like when you go fly and it's PSA, you can get into one line and all the rest of us get into another line. It's supposed to give you greater access.
Okay, but it's an insurance plan. I thought what you did is you paid for everything. They tell you have to pay $50,000 for a year. So you pay that.
Still again, a plan.
Insurance plan?
Absolutely.
Wow.
Absolutely.
So if you don't have any of this stuff,
No, if you don't have any of these things, you are just accessing services different. You're absolutely not out of luck. So the premium for Part A for most people is free. For people who didn't pay in, they are going to pay a little bit higher. It starts at about $524 a month if you did not pay in. But I loved it. Tell me, I'm so sorry. Your name? Jeannie Mae. Do you mind me saying? She did not have the quarters to qualify for free Part A. She continued working, earned more quarters, which is very possible, and then you can access premium free Part A. Part B, it does take care of more than just doctor visits. Outpatient medical services, clinical lab, durable medical equipment, and preventive services. In your book, there are a bunch of these. Let's see, I go to a page where they have them. They start on page 30. Oh, no, they start on page 25, and there are all of these little apples in the margin. Can you guys see those? Little apples in the margin. These are what? What did the apple represent when we were going to school? Apple, okay. It's a doctor. These are the preventive services that are available to you. Do people take advantage of them? No, because most folks have no idea that they exist. These save people thousands and thousands of dollars by getting in front of an ailment. You don't have to be sick to get in there to use these, but you have to be very specific in how you access them. Does your doctor or your doctor's office read this book? Do they have any idea about these preventive services? I doubt it. You have got to be the one to say, hey, you know what? I've been a smoker or whatever. I would love to have a test that's relative to, my respiratory system. Thousands of tests in here, and they're growing. How did these tests even become available to Medicare beneficiaries? You guys remember the whole fight about Obamacare and all of that? The Affordable Care Act made these available and many more things that Medicare beneficiaries are able to take advantage of. That's why, a lot of older adults were out there saying, do not take away the Affordable Care Act and Obamacare, because Medicare beneficiaries were benefiting. All right.
I'm sorry, just a comment. A lot of it are for people that there are income stipulations, right? As far as you have to be low income to access.
For these?
No, not Medicare.
No, for these preventive services?
No.
Okay.
The free services that you were mentioning.
Absolutely not.
No.
No, no. Come all. Absolutely not. Everybody can come.
So the savings plans are for everybody?
The savings plans are for all Medicare beneficiaries. They do.
Low income.
Well, let me say, our services are free to everybody. The Medicare savings plans are specific plans associated to Medicare. Beneficiaries who are low income can qualify for reduced cost to their health care plans. And they're very specific, and I'll talk a little bit more about them. So yeah, thanks for that. So the other thing that I want to mention about these is that there is a premium associated to Part B. This year there's a deductible of $240. The premium is $174.70 a month. That is coming out of your Social Security, right? Some people are paying, most it's coming out of, but with these savings plans, for people who meet the income requirement can have that cost eliminated, right? The $240, that deductible is associated to when you go to the doctor's office and the receptionist says that'll be a $40 copay. Once that $40 knocks that $240 away, then all your visits after that year will be gone. Some people who don't go to the doctor a lot never hit that deductible, and so they pay that deductible until it's met, and then it's just the $174 that comes out a month. We're talking about original Medicare. We're talking about original Medicare. We've covered Part A, Part B. Vision, hearing, and dental is also included in Part B for Medicare, original Medicare beneficiaries, people who've chosen that pathway, but they only get this, it's only covered if it is associated to some accident. Maybe your doctor says, oh my golly, you have a health condition that's impacted by your dental. We're going to have to do some dental work. You can have it covered. But if you have original Medicare, you'd have to purchase an additional vision, hearing, and dental plan. Yes.
This is not related to what we're talking about right now.
Okay.
But I was interested in knowing, do you have an office in an office building in Sacramento, or do you float in Northern California? Or how are you actually, with the services that you provide, administered physically?
I love that. Thank you for that. Our office is, our main office for our HICAP program is in Sacramento downtown. We fortunately counsel all throughout Sacramento, but we have 9 counties in total that we're responsible for. And so we do it at Social Security offices, senior centers, libraries. And so we come here and have an office space, and we have a counselor that comes here certain days of the week and counsel right here. So yes, we are in the 9 counties, and outside of the counties that we are representing, there are HICAPs that also have counseling offices all throughout the country. We also do phone appointments, and we also do video, and we also do screenings. We have all kinds of ways to provide this service to you.
So there's somebody that comes here once a week?
Yes. Mm-hmm.
Is that by appointment, or is that just general?
By appointment.
And how do you make that appointment?
By calling. I'm going to get to that at the end. This brochure right here has all of our information and our phone numbers, all right here. Right. It is terrific. These are some other things that are covered under your Part B. Can Medicare beneficiaries still get the COVID-19 test?
Yes.
And can they get it for free, or does it cost?
Free.
Okay, most folks don't know that. Thank you for knowing it. Those tests now are costing $195. And we've had a number of folks go and get it and didn't know that beneficiaries still are eligible for it. There is, though, this thing that does impact your income or your Social Security in terms of what you are paying for your Part B. If your income is higher than $103,000 and more, your premium is going to go up slightly. This is because of the cost of living increase. If we get a boost of cost of living increase, your Social Security check is going to go up a little bit. Last year it was problematic because some people are on Medicare and Medi-Cal, and they have to stay right in between an income bracket. That boost of income kicks some people off of Medi-Cal, right? And so it's good to be paying attention to this. If your income is higher, there's this calculator that you can go a calculator that you can go onto Medicare, and all you have to do, Medicare.gov, all you have to do is put in your age, put in your income, whatever, and it'll tell you an estimation of what your premium would be in any given year.
So the
Yes.
minimum is 174.
Exactly. Mm-hmm. Yes.
Can you still get the test kits for home use?
Yes. 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 So Part B, there is this late enrollment period for Part B. At your birthday, right? Or if you have had any break in coverage for a break in your premium. Let's say that you are already on Medicare, you decide your daughter has this great opportunity to live in Paris for 2 years, and you go with her and you discontinue paying your Part B premium. You come back into the States, you've had a great time, you've met somebody, it's fantastic, and now you get your doggone check, and it says, oh my golly, you're getting ready to, you lost your Part B premium, you lost your Part B Medicare, your doctor visits, all of those things, and you're like, what happened? And they said, you stopped paying, and now you are subject to a penalty. How much is that penalty going to be? 10% for every 12 months that you didn't pay. How long does that penalty last? This penalty goes forever. You will always pay however many months you didn't, that 10% will be tacked on to your Part B premium for as long as you're on Medicare. Yeah.
Is that the same as, so I have a friend that is, was getting full coverage health benefits, and then she turned 65 and had to, or join Medicare. So if she had not joined Medicare, is that what it would have been?
No. I'm glad. Great. I'm glad you said that. So, for individuals who have, let's say, been working and had full coverage, working and full coverage through their employer, and they worked past, they worked up until 70, right? Once they decide, I'm done, the company says, we're not going to cover you, you'll have to go and choose something else. They select Medicare, they go to sign up, no penalty. Why? Because they've had credible coverage. There's a letter that as an employer, they will provide employees with that letter that says we provided you with insurance. Sometimes you take it to your tax man to say, okay, you know what, I've had health care coverage. That then you show to Social Security, no penalty. Yes?
What happens if you have like this traditional family where the wife stays home and, or it could be husband,
Sure.
takes care of the kids,
Sure.
doesn't work at all?
Sure.
Do those people get, have Medicare from their spouse?
Yes.
Okay.
Absolutely. And if they had been covered, staying on this same vein, if they've been covered by their spouse's health care coverage, the same goes for them. Soon as that coverage in, again, working and have benefits. If you're still getting benefits from your employer, let's say you are CalPERS, you leave and CalPERS has said, you got it free, you know, don't worry about it. CalPERS is paying a hunk of money for it. You may or may not be paying in, but you're not working, right? You have the option to stay with CalPERS, or you have the option to pick up Medicare. Now, I'm gonna get to you. Before you decide as a state retiree to change into Medicare, you have to be very, very sure about it, because once you leave your employer's health care coverage and move away and decide, oh my golly, I don't like it, a lot of times I've not seen anybody be able to go back and say, I changed my mind, state, CalPERS, CalSTRS, I need to come back. No. So it's very important. So yes.
So can you clarify, so if I was my mom's caretaker for many, many, many years, and
Yeah.
I didn't work, and I worked before, so if I qualify by getting my 40 quarters with Social Security, am I going to get Medicare?
You will, absolutely, and you'll be, with the right amount of quarters, the 40 quarters, you'll get free Part A,
Part A.
and eligible, of course, for Part B.
So I'm eligible for Part B, but how do I get Part B?
Signing up, you have to sign up through Social Security. You can go to Medicare.gov, or Social Security is the best place, and sign up. And when you enroll in, you turn on Part B and Part A.
Okay.
And it is a conversation. It would be great to have an appointment with Art, and he'll walk you through all of it.
So I can do that way ahead in advance before, at least.
When you get the quarters. If you have the quarters now, do it. Absolutely.
Thank you.
Yes. Yes.
If you're a disabled veteran receiving treatment from the Veterans Administration, do you need Medicare?
If you were active duty, and receiving TRICARE for life, a lot of times those people are like, we're fine. We have everything we need. It has to do with care, right? The care that you need. The benefits are there for you if you'd like. It's optional, but are you getting the care that you need? Yeah. All right. So here's your Part D. This is your drug prescription. We're still talking about original Medicare. They have plans as low as 40 cents and as high as $188. These plans are available to folks throughout the country. Again, they are determined by Social Security and the drugs that are offered on there. The Part D, though, is subject to you running out of money. Everybody gets $5,030 to spend on their medication throughout the year if they purchase a drug plan. That money, if you use a lot of medications, that money can go fast and you can be out of it. It could be catastrophic, because once you've ran out of that money, then you and the drug plan start paying for your medications until you get up to $8,000. That was supposed to go away. They call that the donut hole. That was supposed to not even be in existence. The former administration kept it, changed it. The Affordable Care Act said this is ridiculous. If you have a plan, and guess what? While you're in the donut hole, you're still paying your premium. You're paying your premium and you're paying for your medication. It's supposed to, next year, this is supposed to go away, but we will see. Your medications that you are on all depend on the drug plan that you choose. There is extra help for folks who may need assistance. There is a late penalty associated to Part D. It is not forever, and it's only 1% for the period of time that you did not or had a break. I have a number of people who say, I don't want a drug plan. I don't want a drug plan, and then later on they decide to pick one up. They purchase it. This year, a lot of people are like, I'll just get it because it's $40 because I don't want to be subject to a penalty. For folks who are original Medicare, in your book, it tells you all about page, I think it's 76. Am I right? Yep, 76. They tell you all about the Medigaps. There are a number of these Medigaps available to people. They run from A through N. These are not Medicare parts. These are not Medicare parts. They aren't A, B, or D. These are plans that folks can pick up, and they used to be traditionally called supplements, but now because the word supplement is used so much with Medicare Advantage, more folks are familiar with them being Medigaps. These are plans that are available to people to pick up, to take care of those deductibles and out-of-pocket costs. So people will purchase one of these. A lot of folks like F and G, some people like N. F and G cover the majority of the necessary benefits, and they do some additional things. I think someone mentioned earlier that you can purchase this Medigap at your initial Medicare enrollment date. When you first become 65 or disabled and want to enroll in Medicare, that's when you are recommended to pick up one of these Medigaps. If you decide not now, I don't have the money, whatever, because they all cost different in different areas. Let's say 3 years from now, you're like, I think I want to pick up one of these. Well, you are then going to be subject to a review. They will screen you. They will determine if they want to sell you one of these Medigaps.
I've been wondering, I have everything now, but I'm told on television, every plan changes.
Yes. Every plan does change, and these Medigaps are the same. That's why it does. So he said on the television, I want you to, on the television, disregard everything. Everything that's healthcare related. Go get a snack. Find something, turn the TV down. Do not pay attention to any of that stuff on TV or any phone calls that you get. We have been inundated with trying to get people out of those plans that they picked up on TV. Some of them were for out of the area. I had one person in Stockton ready to go have surgery. He's seen a great plan on TV. He got to his surgery appointment for his back, and the hospital said, what are you doing with that? We have you down that you had this. He said, I got rid of that and I got this. It was so much better. They said, that plan's for Missouri, not here. You can't, that fast talking that they do at the end of the commercial or all of that literature that comes up at the end, it's not for you. I promise you it's not for you. So if you can avoid any of that television, phone call stuff, and even sometimes things that have been advertised on YouTube and all of that, just ignore all of it. It's better if you do your own research and contact us. Yes?
All the mail too.
All the mail. All the mail. During open enrollment, that mail can become just overwhelming. And do you know what our main call was for this year from the mail? Do I have to sign up for a Medicare Advantage plan? No, you don't. But the mail and all of the advertisement made it seem like that. The California Department of Aging monitors all of these Medigaps, and so this is a great way to stay abreast of them. Medicare Advantage, let's dip into that. So, Medicare Advantage, who has a Kaiser plan in here? All right, who has maybe a Sutter Medicare Advantage plan? All right, these are plans that are all encompassing. They are giving you your A, your B, and possibly your D all in one location. They are the one-stop shop. They now have advanced to also offering supplemental plans, vision, hearing, and dental. And how do you know that you have a really good Medicare Advantage plan? It's hard to know. It is. It's hard to know because you're right back at the service, right? Your plan, when you look in the back of your book, it has all of the Medicare Advantage plans that are offered in our area. If you moved to Los Angeles, this book would look completely different in the back because they're offering Advantage plans for that area. This is just a highlight of the plans. In order to really know what the plan is going to give you, it could be this thick. I've seen it. I went to a presentation and a woman had a book this thick on her plan. Are you going to read that thing? No, probably not until you get to the situation where you have a hospital or you're sick and you're like, what do I have? Well, the plan and all of the description of the plan, the insurance companies used to send you out a little pamphlet that would tell you all about it. Well, now they're not going to mail you and you have to request the description of the plan. We can assist with all of that. We can break the plan down. We can even call the plan and get behind the veil of what really is this plan going to offer you. Because that word supplement is going to tack on more cost. And a lot of people don't know that. The vision, hearing, and dental, you possibly are going to be paying extra because it does not come as a standalone. So there are some extra things, though, that Medicare Advantage plans are offering. People who have long-term conditions or people who have chronic ailments, they can also benefit from a Medicare Advantage plan, but they can also reduce the amount of their Part B premium if they have some kind of situation that requires them to go to the doctor often. So let's go back. Let's go back here. So, Medicare Advantage and Original Medicare. Let's talk about the difference because we've talked about the basics of each one of them. What is the determining factor? Why do people select Original Medicare, or why do they select Medicare Advantage? Why? What's the big difference here? Yes?
Medicare Advantage is on the capitation model, so they have an incentive to provide less care.
Oh, okay. Did you understand what he's saying?
No.
Okay. So, Medicare Advantage, these are HMOs or PPOs. And they say, you know what, come on, come one, come all, you know. And they provide you a one-stop shop, and they have created a partnership with Medicare. And they say, you know what, give us their Part B premium. That $174, if they were on original Medicare, they'd be paying, but the HMO and the PPO say, give us that money. They average it out because based on the number of people, so Kaiser may have, in our local area, may have, I don't know, I'll just say 300,000 people on their membership, right, that are members of Kaiser. All of those folks are paying Kaiser all of their Medicare cost, their prescription drug, their Part B, and their hospitalization, all going there. Now, they say, hey, it's so fantastic. It's managed care. And so sometimes, because they have so many people that they are trying to meet the needs for, and they only have so many care providers, sometimes they lack in service. And this is not my opinion. This is what I know, right? This is from all of these years of doing this.
You said they're lacking?
Lacking services. They can only provide so much care for so many members. Yes?
What's the difference in the Medicare Advantage plan? I have Kaiser. What's the difference between the HMO and the PPO as far as services?
Okay, big difference, because Kaiser being this large network, only Kaiser can offer you as citizens a Kaiser plan. No other entity, AARP, none of those folks can offer that. Only Kaiser can sell you. You can purchase a plan from them. A PPO has gone to a number of healthcare providers and said, hey, we want to create a group of healthcare services to offer, right? And so as a member, you become a member of that small group, which isn't this large HMO, and you get all of your care from people who are in that group.
Is the cost different?
It all depends on who's the insurance company that's selling the PPO.
What's a PPO?
Preferred, what is it? PPO, preferred, thank you. Preferred providers.
What's the O?
Organizations. So, if you decide that, you know what, most times at 65 we have our health care people dialed in, or you may say, you know what, I want some new care providers. If they are in the PPO group, that's who you need to go to. Sometimes the PPO will partner with other folks outside of the area and your health care can be covered. Sometimes though, they're not, and you pay out of pocket to go to anybody outside of the PPO or the HMO network. All right? So if you are in Kaiser, you are subject to only be able to go to those providers inside Kaiser or pay out of pocket. Now, let's go back to the difference. Medicare Advantage, original Medicare. What's the big difference? Okay, so a lot of people would say cost. Oh, I get better, cost savings. It all depends on your health. If you are in Medicare Advantage and you have some chronic ailment and you are going to the doctor all the time and you're going to the specialist, you are coming out of the pocket. I talked to a lady just yesterday, $45 every time she goes. That $45 can add up. She has a higher copay when she goes to see the specialist, and she goes often. When she goes to the hospital, there's a higher, and she has a $8,000 deductible. So she's basically paying for her care. If you look in your book and you look at your plan, if you're Medicare Advantage, it'll tell you what the deductible is that you are going to be paying before your insurance even starts kicking in. That can be very high. If you are a person that finds out, oh my golly, I got this condition, and you have to spend more time at your healthcare providers, there's not a savings there. Here's the more important thing. In PPOs and HMOs, Medicare Advantage plans, you are subject to protocols. Anybody know what those are? Protocols. These are policies and procedures that are in place that the HMO has said are for your benefit and for theirs. It says it's all about risk management. So if Bernita and let's see, Bob and Marcus, if they all have, you will never have this stomach problem. If they all have a stomach condition, they call into their HMO, Kaiser, or their PPO, and they say, I got this stomach condition. By protocol, they have to tell all three of you the exact same thing. Now, is Bob's stomach thing the same as Bernita's? Don't know. Is Marcus's situation the same as Bernita? But unfortunately, the HMO says we have to be fair and we have to tell everybody the exact same thing. Now, you get past the advice nurse and she says, I got to get you in. You've checked all the boxes for a visit to the primary. You get into your primary and everybody, the three of you, describe your situation. Your primary physician has to tell all of you the what? Same thing. And let's say you go and the first thing they're going to normally prescribe you is some what?
Statins.
What is it?
Statins.
They're going to give you some medication after they figure it out. They're going to try to, they're not sure. Are you in pain? What is it? Let's start with the medication. Then they may say, oh, you know what? We're not sure. They're going to down the line get to an x-ray. It never comes up right away. But you're all going to three get the same thing. They kind of think they got it dialed in. How long can you be in this protocol going back and forth to your primary? There's no time limit. So finally, Bernita, you say to your doctor, the stomach thing isn't going away. What do you say?
I need some tests done.
I need some tests done. They do the tests, and then you say, the tests aren't coming up. They don't know what it is. And then you say, get me into a specialist. Well, can you go straight to the specialist in the Medicare Advantage world? No, you cannot. You have got to have your primary doctor. But if your primary doctor says, let's try some other things, what do you have to do? You have to try some other things, right? Can you insist on getting out of that protocol and getting to a specialist? Well, if you have a pretty good relationship with your primary physician, it could work. I mean, you may have this great system where you get right in. Most folks have no idea that they're even in a protocol. You get to your specialist and now you three tell them your situation. Well, what does he have to tell you? The exact
Same
thing. Now, for some people, that just does not work. The protocol system does not work. The managed care meaning that you have a gatekeeper as your primary. After you've seen the specialist and he can't figure it out and you say, well, maybe I need to go to somebody who they only deal with the stomach, because you know they're all kind of categorized now. What do you have to do? Does your specialist send you to somebody else? No, you got to go back to who? Primary. Some people do not like.
You don't have enough money to pay for that service.
Then you don't get it. And if you don't have enough money, and maybe you might qualify for Medi-Cal, and anybody here, Medi-Cal, who's the other? There's another person in here on Medi-Cal? Medi-Cal and Medicare at the same time? It's amazing if you know how to navigate the system. That healthcare is amazing. Yes?
I had a question. So during open enrollment, we have the opportunity to change and look at what we have.
Absolutely.
But I have found that I don't know enough to be able to know, am I in the right plan? Is there something else for me? Is that something you
Absolutely.
help us with?
Absolutely. Anytime. Anytime. Even if you find that, wait a minute, this thing isn't working for me, Medicare Advantage or your original Medicare, that is a time where you can come to us. If you're not sure, well, wait a minute, can I leave the plan in the middle of the year? Is that an option for you?
Sure.
How is it an option? She's saying sure. Some people can qualify for a special enrollment depending on their circumstance. If you move to Davis, if you have some special ailment, there are a number of reasons that would qualify you to make changes to your plan choices outside of open enrollment. So, and you could come to us anytime and we can help with you understanding that. So, there are the differences between the programs, understanding the navigation of Medicare. Enrollment is critical. If you are questioning when you should enroll, or if you had a break in enrollment, those are times to come to us. Social Security, I visited there yesterday. Anybody been to Social Security lately? Oh boy, it is something. I mean, and my highest regard for those folks, because they work diligently to kind of help address the Social Security issues, but they are operating now with half of their staff at home and half in the office. And so, you know what that means.
What's the best way to communicate if you don't want to go there? Can you
That
call?
you can call. You can call. It's a long wait on call. They say if you can do more stuff online, and we can assist you with that also. Right? We have a good back door into Social Security where we can get some questions answered. There are several enrollment periods: initial, general, annual, special, and then the 5-star enrollment period. People can enroll for different times of the year under different circumstances. So, a couple of things that I'm leaving with you. You have gotten a nice overview of Medicare and the parts of Medicare. How to think about choices that you need to make around Medicare are here. Contacting us, very, very important in terms of how you figure out what's going to be best for you, and what's out there is the blue one. Medicare, Senior Medicare Patrol. This entity is designed to help you not get frauded. Why are we losing $90 billion a year in Medicare fraud? Well, because people are emailing, they're doing it to you over the phone, they're doing it to you on the TV, they're going after your Medicare. Why is this important though? $90 billion, that's a lot of money, but why is it important to you individually? If your Medicare becomes subject to fraud and you haven't notified Medicare about it, they may think it's you. And guess what they will do? Suspend your Medicare benefits. How long? As long as it takes them to investigate it. So if you are in any question, you're like, wait a minute, I got this durable medical equipment, I got a scooter in the mail, where'd that come from? You contact us. Oh my God, I got 5 neck braces. Why? I didn't order them. You contact us. You get your summary notice and you're like, I did not get brain surgery. Why do I have this $5 million thing? Contact us. All right? And last but not least, these savings plans. If you do qualify for any of these savings plans, this is a time to contact us. We can help knock off that premium for the $174, and we can also knock off the premium for your Part D. These are fantastic. Medicare is doing a lot of advertisement about these right now. These are not things that you want a broker or agent to sell you, because they reduce your cost as opposed to increasing your cost. So you can contact us about them. The end of this PowerPoint, I have given you a couple of websites to check into. There we go, and there we go. There we go. So, getting onto your Social Security website, if you're going to do things online, there are a lot of bogus sites. So you have to make sure you are on the Social Security.gov website. Same goes for the Medicare.gov. If you're on Medi-Cal, I would not do anything online associated to Medi-Cal. It's too risky. And this agency is fantastic for keeping you abreast of all things Medicare related. All right, we've been together for an hour and a half. I've covered a lot of ground. If you have any questions, we do provide counseling right here at this facility. You all have been fantastic. Thank you very much.